Stagnant water sources like this are great breeding habitat for mosquitoes. Migrating birds carrying West Nile virus are what the females feed on before biting and infecting humans. While the number of mosquitoes in Washington County are decreasing due to mosquito abatement efforts, the numbers of mosquitoes with West Nile virus are on the rise this year in the Southwest. According to the CDC and public health departments in other states, severe cases of West Nile virus are more prevalent this year.
Yeah, it is pretty rare. You know, they don't see this very often. There's maybe a few cases sporadically every year. I don't think we've seen very many down here since 2013. So this is kind of a banner year for West Nile, and I think that's nationwide. There's been quite a few cases in Arizona, and a lot of those have been neuroinvasive. So it's something to watch out for here.
At Southwest Mosquito Abatement in Washington County, an estimated 25% of the mosquitoes captured test positive for the virus, which increases the risk for more human cases of infection.
It's a high concentration this year, probably 25% or more of the population has that virus.
Mosquito season is typically at its peak this time of year due to the migration of birds.
The mosquitoes turn from bird populations which start migrating to they're more opportunistic, so they'll feed on anything. And humans are a dead-end host, so that means we get the virus but we can't give it back to the mosquitoes.
People over the age of 50 are at most risk, as well as young children, pregnant women, or those who are immune compromised. The virus can cause flu-like symptoms such as a fever, headache, body aches, and nausea.
The majority of people are just going to have flu-like symptoms, so they're going to get tired, they might get a headache, they might get a low-grade fever, and just, not be feeling very good. But in less than 1% of cases, it's neuroinvasive, where it's going to affect the brain. They might get meningitis or encephalitis, so it is something to be aware of and to be careful with for sure.
However, those who get the severe cases are very rare.
We have 2 confirmed at this point that we've put out to the public. We have had some rumors, some reports from people, but we really need to get those lab confirmed cases before we can put out any numbers with those.
Peterson says if you don't know if you've been bitten by a mosquito and may have contracted the virus, you should get tested.
So the basic testing is a blood test. They're going to test 2 different components of the blood, which is IgM, which is going to show active infection, and IgG, which shows evidence of past infection. And those 2 things together is what we look at to determine if something is a case.
West Nile virus is not transmissible from person to person. Because there is such a low number of humans infected by West Nile, no vaccine has been developed. However, there is a vaccine for horses.
And then still, people sometimes don't vaccinate their horses. This would be the year to definitely do that.
The main way to reduce contracting the disease is to avoid areas where mosquitoes hang out and apply insect repellents with DEET.
What we advise is that they use DEET or other insect repellent to keep themselves safe. Wear long sleeves, long pants when they can. I know it's hot, so it's hard to do that sometimes. Just being aware of any standing water they may have.
The Mosquito Abatement District needs the public's help in order to know where mosquitoes may be posing a threat.
We treat the major areas like along the river and irrigated fields, but we can't get to every area, especially if we don't know about it. So if people notice that they're getting bit or have a ornamental pond that is got a lot of moss and it's very stagnant, those are the places that we need to know about. We can't know about them unless people call us and tell us about those.
In Washington County, Melissa Anderson, Community Education News.